The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, comprehensive dentistry and what's new in biological dentistry. With us, my first guest is Dr. Michael Schecter. Dr. Schecter, welcome to the program.
Thank you.
Now, they don't call you say Dr. Schecter.
No, I usually go by Mike or Michael.
Pretty casual guy.
Absolutely. I work with my dad in Toronto, and we really try to take a family approach to dentistry.
You and your father, for the most part, under the same roof, you do the same type of things?
I've taken a lot of what my dad does, and of course he's been such a great mentor, such a great teacher, that I've been able to incorporate a lot of his ideas and his philosophies into this comprehensive approach that we have.
What does that mean to you, comprehensive approach to dentistry?
I think that you can almost split it up into two different areas. There's the comprehensive approach in the mouth. It's saying, let's not just tackle this one tooth that has a problem, maybe a tooth needs a crown, but taking a look at the whole mouth and identifying if there are bugs that are causing gum disease, if there are multiple cavities in the mouth, if a patient needs some implants to restore some more biting function, that type of comprehensive approach. Then there's also the comprehensive approach with seeing what else is going on in the body. For example, with gum disease, a lot of times we have these bugs in the mouth that are causing problems.
Are they actual bugs? I mean, like
oh, they're bugs. They're these little squirmy bugs, and you could really see them. And what we have is we have this microscope. We can take a little sample of your plaque, and we can look at it together under the microscope. And
with the patient right there?
With the patient right there. Just the other day, just 2 days ago, I had a patient that came in, and he had a slightly alarming situation in his mouth where there was a little bit of a black growth on the tongue. In short, we were able to clear up the growth on the tongue using some herbals. It was really great, but we also wanted to take a look at why is this happening to him. So, of course, I sent him back to his doctor for some blood testing so we can eliminate any major systemic involvement. But we're also taking a look at some other things. What is he eating in his diet? Why is he susceptible? Maybe taking a look at the pH balance of his body.
Is this your place as a dentist?
I think that it's my place as a health professional. I think that dentists in general have been guilty in the past of only taking a look at the success of their treatment based on what's going on only in the mouth. And I think that we need to be more conscious of what's going on in the body. I always say to my patients that everything that we do in dentistry is toxic and invasive, and it's my job to minimize that toxicity and invasiveness. So we can do that in a few different ways. One, we really focus on prevention in the office. We try to keep
preventing what? Like
preventing cavities, preventing gum disease, preventing the problems that people are often so afraid to come back to see us. And I get it from people all the time. Oh, I haven't been to a dentist in 10 years. I'm so afraid to come to the dentist. Well, if you come regularly, somewhere where you're comfortable, then we're able to keep away a lot of those bigger problems that initiate that fear.
Isn't it tough, though, to get people to do things to prevent something from happening? Because we all put things off. We don't like going to the doctor, I guess, especially the dentist.
It's interesting because in Chinese medicine, you pay the doctor when you're healthy. And when you're not healthy is when the doctor does his work for free. Because it's really our job to help you maintain your health and to work towards to work on that journey of health, to learn more and educate yourself more. And I view it as my job to give information, and it's you as the patient, it's your job to make decisions.
Do you find that if you have a healthy mouth, that you're also healthy in other areas of your life?
Absolutely.
Is there a connection?
Absolutely. I think that the mouth sometimes is a sign or symptom of a greater problem, and oftentimes what we're doing in the mouth can contribute to other health factors in the body. So a great example of this is I have a patient of mine who was diagnosed with lupus, and she was very alarmed. She's a young woman. She's 32 years old. She has 3 children, and out of nowhere she got this debilitating disease. She started investigating the situation and started to understand that a potential cause of lupus is mercury and the amalgam fillings, the mercury fillings that we used to use in dentistry.
Interesting.
And she came
There's data to back that up, what you just said, that there's a connection between mercury fillings and
autoimmune diseases?
Yes.
Absolutely.
Okay.
I'm not going to sit here and tell you that having mercury fillings in your mouth is going to cause disease.
But it can only help, I guess, to take them out?
The amalgam fillings is a potential source of mercury in the body, and mercury is the most toxic non-radioactive substance known to man. It is stored very readily into the deep tissues of our body and is very difficult to eradicate. So this woman who has lupus came to see me. We took out the fillings. She went through a process of removing the metals from her body, and she has now been symptom-free of lupus for 1.5 years.
Now, biological dentistry, we'll start there. What does that mean? What does that mean?
I think it's simply saying that we are understanding and connecting what's going on in the mouth with the rest of the body. Understanding that there's a biological process that happens, but staying rooted in science. So as your health practitioner, I'm prepared to stay current and follow science and move with science, but always stay within what has been published and researched.
Now, for people just tuning in, you do traditional, what we would call traditional dentistry. You do dental implants,
Absolutely.
placing and restoring dental implants. You do fillings.
I offer everything that a regular dentist offers. I offer all the materials. I offer the same freezing, everything that all the same pharmaceuticals, everything that a dentist offers. But on top of that, I'd like to think that I offer choice and education.
Now, when we invite you on the show, this is a hot topic. We get a lot of emails, people concerned about root canals, fillings, things like that. I mean, do you hear that a lot? I mean, is it more awareness of saying, boy, I got metal fillings, I got to get them out of my mouth?
I think that as a population, we're becoming more aware in North America. I still think that there's room for that to grow. But of course, people come in all the time, and whether they realize it or not, these are questions that they have to ask. And I consider these controversies in dentistry. I don't think we've reached an end stage to know that root canals are 100% unhealthy or healthy. I think that you need to look at the overall situation.
So are patients coming in and asking for this kind of dentistry? I mean, is it called holistic dentistry?
It's similar to holistic dentistry.
What do they call it, though? I mean, what do the patients say? Metal-free dentistry?
Oftentimes patients, they don't really know what they're looking for, but they're looking for minimal toxicity and prevention. They're looking for ways to increase their overall health.
But can you get the same results, though?
Absolutely. I will never compromise long-term functionality and long-term success of dentistry for holistic practices. I actually will combat that with saying that I think I get better results. Patients that respond well to homeopathy, patients that don't use pharmaceuticals and pain medication, antibiotics for their procedures, heal better and heal faster.
So after dental school, extensive training in homeopathy, what is homeopathy?
Homeopathy is a really interesting modality of medicine. I've been studying with Dr. Andre Sain, who's one of the foremost homeopaths in the world. And basically, what homeopathy does is it takes a holistic approach to health and says that you have to get your hygiene or your lifestyle up to proper balance before you can even intervene with therapeutics. It recognizes that far more so than just pharmaceuticals, we also need to live well. And that's having a balanced diet, having balanced sleeping schedules, exercising well, stress relief, adequate sun, which I know in San Diego you don't have a problem with, but in Toronto we definitely struggle with getting enough sun. And it's making sure that all of those parameters in our life are balanced.
Now, is this fair to say, though, that you say, because we talked on the phone, that pH balance, gum disease, rampant decay are all signs of poor homeostasis, is what you said. And so elaborate on that.
Yeah, I think so, because oftentimes people come in and they say, why am I getting cavities? And they're brushing their teeth, they're even maybe flossing their teeth, but they're still having...
Isn't it just from not brushing?
Well, I think that there's a greater picture involved. And and each of those things is almost its own story, but take pH, for example. pH is the balance in your body, how acidic you are versus how alkaline or basic you are. And if your body is too acidic, then your saliva isn't buffering bacteria, and you're going to have more decay. You're going to have more cavities.
Interesting. So people with great teeth, do you find that they have higher alkaline?
I would say that people that have great teeth and have great gums often have a very balanced pH or slightly alkaline pH.
People like with periodontal disease, like bleeding gums, bad breath.
So with those type of patients, they always come in and say, why? And it's easy. It's really hard in this short.
They say why what though? So I'm clear on this.
Why do I have bad breath? Why am I losing my teeth? Why do I have gum disease? I brush my teeth every day. What's going on?
Yeah.
And it's very difficult in this short period of time to go through that comprehensive answer and the full investigation as to why. But it's all about tools and knowledge. And so I don't think that there's ever any one patient that comes into the office in one day and will have a complete printout where they can say, if you do this, 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 and this, then your gum disease will completely go away.
But you could turn that around, though.
Absolutely. And we go through an investigation of how are they living, how are they eating, and we also get specific in terms of what bugs are bothering them. And I always say to my patients like this, I don't mind the type of treatment you choose to get rid of the bugs. The fact of the matter is that we have a diagnostic tool, we can see what bugs are there, then we can decide on treatment. If you want a pharmaceutical approach, great. If you want an herbal approach, great, or a homeopathic approach.
So you kill those bugs.
But we kill the bugs, and then we take a follow-up slide to make sure they're gone. Now, what I've been learning through experience is that only targeting the mouth, we sometimes aren't able to get rid of all the bugs. So, for example, if you have parasites in the mouth, I can give you some great herbals for the parasites or some pharmaceuticals for the parasites. But unless you take a look and get to the source as to why are these parasites there, what's going on in the body, then you'll never completely eradicate the parasites.
It is unusual to hear from a dentist saying you should, about sleep and stress and these kind of things.
Well, it all plays a role. And if you think about it in terms of nutrition, you are what you eat. And we're so often neglectful in terms of how we eat, putting too many stimulants in our body, eating too acidic of a diet, all the refined sugars, all the processed foods. Unfortunately, we live in North America where
do they want to hear this, though? They go to the dentist, they just want you to fix their problem?
Well,
what is the response from patients?
I think that
they like this?
Patients love it because it's giving them a why instead of just fixing problems. And I find that, patients want their fillings fixed, they want implants placed, and I do all that. We do all that as an office, and it's important. But I'd like to minimize the type of trauma that a patient undergoes. And especially with children, it's really great, instead of just fixing their decay, taking a look at how much pop are they drinking? Why are they getting so many cavities? So
you're asking the why, because is your hunch that there's not enough of that going on with other dentists? I mean, somebody has a bunch of cavities. I have kids. So you're saying why? Why are they getting cavities? I mean, is that what goes on in your head?
Absolutely. And as a human being, we should not be as susceptible to decay. We should not be as susceptible to gum disease. And it's about building up a child's nutrition, making sure they're not as susceptible to decay. Because you also have to think about it. If a child has tooth decay, that's something that we can see. But what else is going on in their body where they're not as well? Maybe we're not seeing those symptoms as quickly.
Interesting. Very interesting. We're going to take a quick break. Back to more about biological dentistry. You're watching The Wellness Hour, the leader in medical news and information. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, biological dentistry. We're here with Dr. Schecter, Michael Schecter, and we're discussing in the last segment a little bit about gum disease. I mean, you look at it differently.
Yeah, I think I can really explain everything with a case, because people are individuals, and it's really easy when you take a look at a previous patient and see how the journey they went through. So he came in to see me, and very friendly man in his 50s, great guy, and he was worried because his two front teeth were very, very loose. When I took a look in his mouth, they were so loose that they could have come out just in my hand. And as a dentist, my first instinct is to say, I got to get those teeth out, I have to restore the area, I want him to look aesthetically proper, be comfortable, he's a musician.
That was your training in dental school?
Absolutely. And it's still obviously a part of the treatment plan that I was putting together for him. But what I also
saw... So this was past save those teeth?
100%. Okay. They were hanging by a thread. And what I also realized was that his gums were almost blue. And he hasn't been to a dentist in a few years, and I got the feeling that his health wasn't 100% there. So we took our normal information, collected some information, we took his blood pressure. His blood pressure was 180 over 100. Your normal blood pressure should be 120 over 80. 180 over 100 is already in the area where I'm concerned about working on him without doing some due diligence and speaking to his doctor.
Okay.
So I went through the conversation with him, explained to him what was going on, and he became very interested in my approach and didn't want to segmentalize his problems into gum disease, tooth loss, high blood pressure, and these other areas, but wanted me to help him work on improving his lifestyle, balancing his lifestyle, and using non-toxic therapeutics to help treat him. So homeopathy is always my number one choice. It's non-invasive, non-toxic, no side effects.
These are herbs?
It's not herbs, actually. It's potent-sized remedies on glucose pellets. Okay? And I'll go into it in a second.
All right, okay.
But what you do is you take a case of a patient, and you take his overall picture, find out really what's going on, and try to match that to a remedy. So we took his case. After collecting all of the proper information, I knew specifically what bugs he had under his gums, I knew exactly how much bone he had, we took necessary x-rays, all of the regular information collecting that a dentist will do. We then took a case, and his remedy picture just screamed out at me. Okay? He's Natmure, which is table salt. Okay. He took the remedy, and that night in his bed, the tooth came out onto his pillow. Okay, he called me in the morning.
But that doesn't sound good. I mean, was that the goal?
It doesn't sound good, but that tooth needed to come out. That tooth needed to come out, and I was concerned to take it out because of his other health issues. And it was almost like the body was triggered to heal and was removing that infection.
Interesting.
The tooth came out. Within a week, his blood pressure had regulated to 125/95. His blood sugar came down from a 12 to a 6.
Just because his tooth comes out?
Everything.
Infection goes away?
It's not because his tooth came out. That was another side effect of the remedy doing its work. What we saw overall was a movement towards health. His gums became pinker. The bacteria, the fungus, the parasites that we saw under his gums started to disappear.
With things that kill those bugs. It was like a combination therapy?
With the remedy that he was taking, along with some hygiene that we were doing. Like I talked about earlier with homeopathy, it's about getting hygiene up to par, and then also using the remedies as the therapeutic response. So now the beauty of this is he came in to see me looking for a solution to one tooth, and he left with feeling better overall.
Backing up to dental implants again. I guess antibiotics, is that right? Oftentimes are used, and you don't like to use those.
I think that we need to keep everything in our arsenal. It would be a mistake to say that I will never use antibiotics. It's not my first choice, but it's a choice. I think that the benefit of using remedies is you don't have the side effects, you don't change the flora in your body. A concern with antibiotics, and I've seen this with the slides that I take, is that 90% of our cells in the body are non-human cells. When you take an antibiotic, it has the potential to wipe out some of the good bacteria with the bad bacteria. So what we're trying to do in the office now is minimize pharmaceuticals and maximize healing. So remedies is a beautiful answer. I just had a woman.
So you have a pre-care and post-care for dental implant patients?
Absolutely. I just had a woman a few weeks ago who came in and she broke her front tooth. It needed to come out. And, you know, she's an aesthetically driven woman. She wanted the same day to have a tooth put in. And we took the tooth out, put an implant in, and instead of using pain medication and antibiotics, I gave her a great homeopathic regimen. She was pain-free. I saw her 2 days later. I was able to take out the stitches. And traditionally, you usually wait around 7 days. Because she healed so quickly with the herbal rinses that we use and the homeopathic remedies that we use, she was fantastic. And it's such a great option to offer patients.
Now, in Canada, is this rare? I mean, do you know of other dental practices doing it like this?
I don't think so. I
mean, you don't know of any.
I think that there are some dentists that are recognizing the holistic approach, and they're recognizing that there is a need to integrate what's going on with the mouth with the rest of the body. But what I'm finding is that some dentists aren't taking it to the next step. So there are holistic dentists who practice with a similar philosophy, but then when they need implants done or they need wisdom teeth extracted, they refer it out. And in my head, I feel that I'd like to keep everything in-house so that patients can better take advantage of the services. I don't see much point in sending a patient out to have their wisdom teeth extracted if then they're going to need the pain medication and antibiotics.
Is this the future of dentistry, in your opinion?
I believe this is the future of medicine. I think that we're really starting to see a shift where people are becoming aware that eating plays a huge role in your health. And the amount of sun plays a huge role. You see all over the place, people are taking vitamin D supplements and concerned about how much sun they're getting. And
it's fascinating to hear this from a dentist, by the way.
Yeah.
You know, our show airs, all over the United States. We're in Canada now. And I always like to think that I've heard it all sometimes, but this is great. I hear this from some of the medical doctors, and so you're combining that.
Well, I think that what I'm able to see is a lot of the signs and symptoms that happen in the body, I can see them in the mouth. If you're deficient in sun, deficient in vitamin D, it's not only going to affect your bones, it's also going to affect your teeth. So I can potentially see that. If I see a patient and I see that there are things going on and it doesn't make sense, why is someone so early losing teeth? Why does someone have such puffy gums if they take care of their mouth?
You can stop that and turn it around. Oftentimes.
Absolutely.
Good.
That's my job. And it's about working with patients towards health.
Now, what about root canal? And we are out of time. I mean, what are your thoughts on that?
I think that root canal is a controversy. I always have to question, is it better to replace the tooth with something else or try to keep
what is a root canal, by the way? I should start there too.
Of course. A root canal is normally you hear of a filling. A filling is when we take bacteria or decay out of the top of the tooth and fill it with a material. Sometimes that decay or bacteria gets too deep into the tooth and it involves the nerve area, the roots of the teeth in the bone.
So it's a bacteria that's hitting the root?
Yeah.
Okay.
And so what we do is we go in, we shape those roots, we clean them and fill them. Traditionally in North America, we use a rubber-based material that has no antibacterial properties. So we just fill that one long root, and we rely on the body to resolve the remaining infection. There's a different type of material that's been used in Europe for 30 years. It actually is very alkaline. It's very basic. It diffuses into the tooth and diffuses underneath the tooth
into the bone. This is what you do?
This is what I use.
Okay.
And it helps to neutralize that long-term, low-lying chronic infection that can persist. Now, as a practitioner, I offer both materials. I go through the educational process and allow you as the patient to make a decision. What are you comfortable with?
So your father, Dr. Ira, do his patients, are they resistant toward you?
No, I think actually it's the opposite.
You look so young, by the way.
Thank you. I think that patients are excited because it does a few things for them. Specifically with me and my dad, there's a lot of continuity there. But I also think they're very receptive because patients in general are becoming more educated and more motivated about their health. And it's not just good enough anymore to say, oh, we're just going to put this filling material in and you'll be fine. But they want to feel ownership for their health and feel responsibility for their health, and we're able to provide that. I think something just as simple as filling material. And I have this video here that...
What am I seeing there?
You're seeing
a vapor of some sort?
It's the mercury vapor that is consistently emitted off a tooth. And it comes off 365 days a year, 24 hours a day. The mercury just evaporates and it gets integrated into the body. There's been a switch, and my dad actually was one of the initiators of this. He switched in 1986 to using a resin filling material that's different than...
That's the white filling?
Those are the white fillings. And they have been shown to last as long, be as effective as the older mercury fillings. So we use those in practice. And now,
tell me this, by the way. Somebody watching this, they have metal fillings in their mouth. I mean, do you say to those people, get them out, put...
I don't ever say to somebody...
everybody, but
I'll never say to somebody,
get them out.
What I will say is these are the potential health risks. These are the potential...
If it was a friend of yours, what would you say? Would you say... get them out?
No, because I think that each individual person has to take a look and see what is going on in their body.
All right.
If somebody is not well overall, it might not make sense to take out those fillings right away. If somebody has a very, very deep filling, they have to weigh the risk of, if I remove this filling, am I going to need a root canal to replace the filling? So there's a lot of parameters that go in, but absolutely 100% I consider that material to be unhealthy and toxic. And we take a lot of precautions in the office to ensure that you're not exposed to the material while we're removing the filling.
And we are just about out of time, but how is homeopathy different than pharmaceuticals? I mean, as you see it.
Well, I think
the advantages, I should say.
I think the first thing is that homeopathic medicine focuses on lifestyle or hygiene just as much as therapy, and that's critical to understand. But even just in terms of the remedies themselves.
Yeah, what are those, by the way?
These are my little homeopathic remedies. So this is hypericum, which is St. John's wort. And what they've done, I can show you here, is they've taken the St. John's wort, which is a plant, and they have extracted the essence of the plant in oil. So these remedies here, these little pellets here.
So those little pellets.
These little pellets are diluted to the 1,000th potency. So what they've done is they've taken that St. John's wort.
You swallow those?
You put them under the tongue.
Let them dissolve.
They dissolve. If it's not the right remedy, it does absolutely nothing to you. It's just an energetic potency on a sugar pellet. And it's really wonderful because it's a gentle medicine. There's no interactions. There's no side effects.
And you use that particular therapy for what problem?
It's individualized to the patient. We're trying to predict the patient's symptoms, but often hypericum and arnica are two really great remedies for trauma, pain, bruising, nerve issues. Oftentimes I have a patient where we do a deep filling, and it's borderline. Is this a root canal? Is this not a root canal? And in modern dentistry, there's nothing that we can do to help that patient heal, to try to take that situation and bring it towards health as opposed to root canal. Hypericum is an excellent, St. John's wort is an excellent remedy at helping that nerve tissue resolve so that it potentially doesn't have to go to root canal. I just did it on my brother 2 days ago.
So you're seeing a difference. I mean, you see, once you started combining these therapies, your father sees a difference.
Yeah.
That people are getting better faster?
Absolutely.
Or maybe avoiding...
And I think the whole idea is that I'm not trying to do something to be different. I'm trying to do something to improve people's health. And anytime you can...
So this is not gimmicky?
Absolutely not. Anytime you can trigger somebody to heal, you can heal faster and you can heal better, why not? And if there's a time when I need to use a pharmaceutical, I'm happy to. But I find that the body responds better, and the more often somebody uses homeopathy, the better they respond.
Are you ever surprised at the results?
Often.
With this stuff?
Often. very conservative in my treatment, and I'm very cautious with how I go forward. And so I'm often surprised as to the speed and effectiveness of the treatment that I'm doing.
So your father, who's been in practice there since I guess the 80s, are his patients resistant to this kind of treatment?
I think that as long as you present something to somebody in a logical format, they're receptive. You have to be willing to listen.
I mean, are they asking for it now?
Who doesn't these days say, I'd like to minimize antibiotics? It's becoming such a well-known idea that antibiotics can cause harm, not just to us as people, but also to the environment, to the world around us. We're trying to minimize these pharmaceuticals. And to use homeopathy where there's no side effects and no interactions is wonderful. Pregnant women that come in with an emergency, and previously I'd be very frightened to give them an antibiotic to control that infection. At the same time, you don't want to allow an infection to persist in a pregnant woman. I can give her remedies. I don't worry about it. It resolves. It's fantastic.
Is your father, has he changed protocols?
Absolutely. I think that we're all changing and evolving as science changes, as we learn more. And just as an example, what we're starting to do now is preloading patients with usually arnica before surgery. We do it for a week before, and it really helps to minimize post-surgery trauma and pain. People just heal faster and easier.
Very interesting. I want to thank you for coming on the show. We'll have to have you back. I mean, this is a very big topic, and so you say it's the future of dentistry. So what do? You ask your dentist, look for a biological dentist, look for a holistic dentist?
I think that too? A lot of it comes from educating yourself. Look online, start reading, and then go and ask your dentist questions and find a dentist that matches with your philosophy.
Great. All right. I want to thank you for coming on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.